Cheekbone area, festoons, mailer bags. Restylane was done 18 days ago. How long will it stay puffy and what can I do? It has gone down from big swelling and a bruise to a smaller one, but it is still puffy. I have read the reviews for similar problems, and the average healing time is 2 weeks. I contacted my provider and she told me that it can take up to 4 weeks. I am going on my 3rd week on Monday, and I am still puffy, which makes my face look unbalanced. I'm only bruised on one side. The left side came out perfect.
Thank you for your question. You submitted your question with several photos, and you state in your question that you are essentially 18 days out after getting Restylane placement in the cheekbone area, and that you're concerned that there is still swelling and asymmetry. And you stated that there was initially a significant amount of both swelling and bruising that has gotten better, and that when you have looked at and done research, you saw that most of this should be resolved at 2 weeks, and so you are concerned, and you state that your doctor advised you to wait 4 weeks. Well, certainly I can understand your cause for concern reviewing your photos. I can certainly suggest to you a strategy that might be relevant and should be discussed, I think, or I would advise you discuss with your doctor. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. The use of injectable fillers is a very significant part of my practice, and helping people get nice-looking cheekbones has been something of an evolution in my own practice, and I'll certainly share with you my philosophy that guides how I can essentially avoid situations like what you're in currently. So to understand, first of all, your doctor's intention, the doctor wants to add volume to compensate for volume loss. And the general philosophy of fillers is essentially to place fillers within the skin, which is intradermal, or under the skin, just below the top layer, the layers of skin, which is in the fatty cell layer. Now the challenge, the way I look at facial aging is what really guides my approach, and I look at this area, particularly the cheekbone area, as a function of bone loss. And so as a function of bone loss, the placement of filler more superficially can commonly result in something of what you're experiencing now. When I look at your photos, I see a very distinct outline of the filler, particularly in the right cheek area, and it is often perceived as, it can look okay, but if it looks obvious, then it's not so great. And what is often a criticism is that the filler is placed superficially. Well, when it comes to these layers of tissue, we're looking at very, very thin layers, and superficially is relative. So understanding that this filler was maybe placed in a way to try to mimic the appearance of the cheekbone is something that is commonly practiced. And we have seen patients with this situation, and essentially what I've done is I've dissolved the filler and I started from the beginning. And when I say the beginning, essentially what I do is a technique called structural volumizing. And the point of structural volumizing is to address the volume deficit at the level of the bone. What that means is, through specific techniques, I place filler between the muscle and the bone using something called blunt cannulas. I also use a different type of filler. I use fillers that are in the thicker category, such as Juvederm Ultra Plus or Juvederm Voluma. When placed at the bone level in a specific way, we've been able to actually achieve very nice cheekbone definition with no evidence of irregularities avoiding swelling and bruising, and ultimately getting very nice balance and symmetry. Our patients very often will just give them the mirror and they'll see the results immediately. And I can certainly tell you it's been a significant paradigm shift in my approach to helping people with the same issues as you are dealing with right now. So essentially the solution is defined by defining the problem. And the problem is bone loss. And however, the majority of colleagues place fillers more superficially with the idea of trying to mold and shape. But when it's under the skin, it also is less, it's a little less easy to manage creating that shape. And it's a challenge to get it to behave in a way that is consistent and predictable. So I think that I think this discussion should be brought to your doctor. Certainly at this point in time, this degree of asymmetry and the appearance of swelling is not optimal. And therefore, it is up to you and your doctor to decide what to do. It may mean some dissolving. It may mean changing the strategy overall. You know, I think this frustration that you're experiencing is actually very, very common. And we see patients with this challenge very frequently. A lot of times people see others who have had fillers placed in their cheeks and they don't like the result because they look too rounded or pillowy. And with structural volumizing, going back to it, is because working on the bone structure itself is much deeper, and therefore the layers of tissue over it prevents this very obvious outline kind of appearance that is more characteristic of the material and the layer in which it's placed. So I don't think you need to abandon your doctor, and certainly if this was the first time you're doing this, it's important that you and your doctor figure out what works best for you. But I think that it's fairly straightforward to me that your anatomy is reflective of many of your contemporaries, where soft tissue loss, bone loss, and thinner skin is a kind of a setup for a limited volume correction unless the material is placed deeper. I think that's basically the strategy that I would employ for a person like yourself in my practice. So I hope that was helpful. I wish you the best of luck. Thank you for your question.